because I would have aggravated at least one of them enough to send me something. But maybe it's a good thing. I'll be standing by. Yeah, thanks, Howard. It's a culture change for the group. They're not used to consuming information that way, so they have hard copies for years. We're doing a hybrid, so every 2 months they get a newsletter, and it alternates between the online digital version and the printed version. We get the best of both worlds, and tradition is tradition, and it's exceptional in the printed version. So they're always trying to step on boundaries. So we're just offering some different choices so that members can pick and choose what they like. AA4FL for ID Medical Image Radio Council. That will be at the top of the hour. I will be the net control. Is there anyone else that is here on the Quadnet Array that would like to do an early check-in? Go ahead and make your calls. AA4FL. Quiet morning. Chip, N5RTF, I had lost you before. I'm not sure where the issue was. Are you having any technical problems on your end today? N5RTF, AA4FL.
AA4FL and 5RTF. The only technical problem I have is one that I keep having, is that I have to reboot the iStar every Saturday. Because it's on and I'm getting the readout on the dashboard, but I don't get any voice unless I reboot it, and then all of a sudden the voices start. That sounds strange, doesn't it? But it's I don't know why it needs to be rebooted over and over. Going back to your previous discussion, I felt a little embarrassed that my home and vacation home are only 17 miles apart. But that's just laziness on my part. N5RTF.
Well, you have the best of both worlds, Chip. I mean, you've got two vacation homes. I mean, one in the French Quarter and one out in nature. I mean, what more could one ask for? Over?
Well, fortunately, Terry and I like almost exactly the same things, so there was never really much discussion about either, because we like both places and we're going to hang on to them as long as we possibly can. At some point, we may have to go down to just one, but that's going to be a hard decision. N5RTF.
N5RTF, AA4FL. I imagine the French Quarter place would be a nice rental to supplement it. So I was thinking of the same thing here in South Florida, at least for here, more of a seasonal thing. My parents' villa would be highly desirable for 4 or 5 months out of the year. Nobody wants to be here in the summer, but I would. We may at some point just do that, try to find somebody that just wants to be in Florida for 4 or 5 months out of the year. Rent it to them during that period, but not quite now. Let's see who else is here early. I'd like to do an early check-in for the Medical Amateur Radio Council Digital Voice Snap. This is AA4FL. We'll be your net control at the top of the hour. If you'd like to do an early check-in, go ahead and make your call now.
Good morning, Jay. Good morning, everybody. This is PY2 BBQ, Hilton, São Paulo, Brazil. Back to you, Jay. A4FL, PY2 BBQ.
Okay, thank you, Hilton. Good to have you here again today. And I see Andy WJ8B is also with us here. He's gone ahead and let us know that on that logger, so I'm checking in, Andy. And look forward to hearing from both of you, Hilton and Andy, here when the net starts in a minute. Any other early check-ins? This is AA4FL. Steve, if you're copying me, K3FZT, we had the same issue last week. For part of it, you pop in and be there, but then go on. So just to let you know, that's what happened again today. Just for 1 second, you showed up and never heard anything from you, but at least you made it into the last heard area. This is AA4FL, and it's top of the hour here, so we're going to start the Medical Amateur Radio Council Digital Voice Net. Thank you for joining us. This is Jay, of course, and AA4FL today. Jay, I am operating from South Florida, from Palm Beach County, from Delray Beach, Florida, and I have gigabit Ethernet here versus 12 megabits per second last week, which seemed to have been a curse when I tried to run the net out of Hawthorne, Florida, although it usually do just fine. So I'm not sure exactly what was going on last week. Want to drop one here? Hey, AA4FL, the Marco Digital Voice Net, and we have a discussion forum for current medical events and issues, or friendship issues, amongst those of us that are members. But if you're not a member, of course you're welcome to attend the net, participate in the net. Please check in, and we'll give you a chance to ask questions of our members that are present. And all members internationally are welcome to attend and participate in the discussion. So directly networking from the login list, so make your calls through me at Net Control. We do have NetLogger running, so you can see who's checked in. And it's pretty interactive net. Everybody gets a chance to have a discussion. And we'll go through at least one round and then see if there's follow-up questions. We meet every Saturday, 1500 UTC. Let me let it drop one. So we're meeting here on the QuadNet Array every Saturday at 1500 UTC. They're linked repeaters throughout their region and their servers, and people that are coming in through DV6 and such. So with all these different modalities and the transcoding of all the different digital modes that any of the participants are using, allowing us to do it through the magic of the QuadNet Array, but please realize that you just need to give a little time for everything to synchronize. So don't tailgate. And before you transmit, just before you even key up, let everything get a chance to sync. And then once you do key, pause before you talk, and performance will be a lot better on the net. Are there any stations with emergency traffic or priority traffic for the net? If so, make your call now. Are there any mobile stations or stations that won't be able to stay for the duration of the net? Would like to go ahead and acknowledge you so that we can get you first on the list for discussion. Go ahead and make your call now. Okay, well, none here, so we'll have a regular participating net here and have check-ins in just a minute. And everything seems to be quiet here today in Florida. We're seeing that COVID's quieting down. Delta is seeming to be on the decline here. The positivity rate's down to 5%. A lot less nervous people here, but everyone is still on guard. And again, I'm in Palm Beach County right now. It's just
KO4NSY, listening.
KO4 LSY. Thank you for checking in here. I went ahead and logged in. I know you're listening. Do you want to participate in the roundtable discussion, or did you just want to listen today? Over.
Roger, I'm just listening. I'm mobile in about 2 minutes from my destination. Over.
Well, thank you for letting us know. I hope you're having a nice day, and thank you for stopping by. And please do listen until you get destinated, and any time that you can. We're going to be probably for the next hour here on the net, and we're going to be discussing medical topics of the day. Thank you. Any other check-ins? Make your call, AA4FL. Okay, no other check-ins at this time. And we'll just start going down the list and let everybody. I don't have any burning conversations today. I mean, if anybody'd like to comment on the ether and some of the technologies that are there, and if they're in the context of COVID, even better. I had asked a question of some of you if you saw the image of me. Nobody's responded to it, so there was an image of me in the newsletter. But I'll let you elaborate on that if you think you know the answer to that question. Jeff, N5RTF, go ahead and take the mic.
Oh, you caught me off guard. I was taking the dog outside. What was the question?
When I sent out the Ether newsletter, there are a lot of images inside the newsletter as well as links. And the question was if anybody could find the image of me that wasn't so obvious in the newsletter. Over.
No, but I'll scan it more carefully next time and see if I can. Sounds like a trick question, so I'll go on with it. N5RTF.
Well, Chip, as somebody who does a lot of web design through the years and find ingenious ways to hide things that make it hard to find, and a lot of times, just to get the search engines here, the search engine optimization, doing silly things, and of course it doesn't know strategies don't always work anymore. The algorithms, I'm sure, avoid it, but like having white text on a white background just so that the spiders find you. until the robots find you. But now this one's an image. But what else would you like to report, Chip, for today? Is the time are you available to talk now? Tell us about where you're at and what you're seeing and what you're up to. Over.
I've been away from work for a week, so I really don't have a feel for what's going on at the hospital. I checked some messages and filled some scripts and things like that, just online for an hour a day. So I don't have, so somebody else doesn't have to do that for me. But aside from that, I've tried to stay, out of it as much as possible. So I it really just sort of gotten into the. I'm building a pier, very small pier. My boat came in. It's in the garage. I've got to get the registration letters, numbers, and everything on it, and then get some people to help me move it back to the water. So just just simple projects like that. It's been a good week in 5 RPM.
Uh, Congratulations, Chip, on your new KTH. It sounds wonderful. I hope to have some. I have a few USOs there in the future, and hope you'll come down here to Florida and do the same. And we always enjoy spending time with you and Terry and we're seeing Scooter. That's AA4 Alpha Medical Amateur Radio Council Digital Voice Net. WA1EXA, Mark, how are you doing today?
A4FLWA1EXA. Oh, we're doing fine. Yeah, weather up here has been beautiful. We've had a few days of rain, which we needed, but we're well above our average, so our water tables are full, and the weather's just spectacularly clear, and temperatures have been going between the lows of about in the high 40s to the highs in the low 70s. So that's terrific weather for here for spring, or for the fall, I mean. The leaves are changing up north, not where we are, but up on the northern part of on the border, Canadian border, it's at its peak. And I know people are going up to Mount Washington this weekend in New Hampshire, break one. And the COVID situation is really kind of quieting down. I don't want to say it, and I don't want to jinx it, but things are really quieting down, and the rates are getting low, down around 1%, positive rates, and all the other statistics are decreasing. We're starting to get our regular flu shots. I got mine this week. Of course, we went to get the trivalent, quadrivalent. I think it's quadrivalent. Higher dose because of my age, and those are kind of harder to get because they don't have as many of those. But it is available. People are starting to get those, and I'm getting ready for Columbus Day, which is on Monday. It's a holiday here, and a lot of people do come up to the Cape. It's the last hurrah of the year. After that, it really gets quiet here. So we expect this weekend will be slightly busy, and then after this, the things are going to close for the winter start closing. Wait one. Hey, all of the mums are out. At this time of the year, the flowers are starting to go. We haven't had any frost yet, but which is unusual. Usually, by now, we would have some frost, killing frost in the northern part of the New England, and we have not had that. The Boston Marathon, which normally runs in April, is running on Monday, and that's the first one in the past 2 years. So they're expecting a lot of people up there. It's a kind of a big deal in the Boston area. Um, and beyond that, we're just getting ready, starting to get ready for the winter, and to bring things in and tie things down and finish doing anything we want to do to the house. We have the windows cleaned and stuff like that because once it gets cold, it gets cold, and outside is not usable. But right now we'll make it as long as we can. So back to you. Oh, there's only one discussion up here. Is there is some discussion on whether or not the booster is actually needed or not. I know that the Pfizer booster just got approved, and the Moderna one has not yet come out. Um, but there is some discussion in the area of how much loss of antibodies there really is, and is it requiring another booster shot? And we're kind of seeing what when it finally comes out, when the smoke clears there, and whether we get it or not, we'll find out probably over the next month, I would say. So back to you. A4FL on the road, WA Winnie XX.
Well, thank you, Mark. Thanks for letting us know what's going on there in Cape Cod, New England. Before we move down the list, are there any other chickens, any regular chickens here that are just running a little bit late today and haven't checked in yet? If so, go ahead and make your call. Okay, no additional check-ins for Howard, N9OML. How are you doing today?
Good morning, Jay, and everyone on the net. I'm doing fine. Things are okay with me. A little bit of sore trouble, but that's plenty standard status there, it seems. So they drew off some fluid and injected it. But other than that, just chugging along. As far as the Chicago area, they're still continuing to cover COVID, obviously. It appears Chicago and Illinois numbers are improving slowly but steadily. There is some coverage of occasional outbreaks in school requiring reversing back to hybrid learning, but it does not seem to be a major wave of problems. The Trotsky's most frequently covered stuff is, of course, anything controversial. So any mandate or any science that comes out, there's a kind of polarized debate that we seem stuck in. But science-wise, there hasn't been any big development that I'm aware of in our area.
This is PY2BBQ. Lost the reception, both from Howard and Jay. I just transmitting to see if this is my problem or everybody's problem. So back to the net from PY2BBQ.
Well, thank you for the report, Andy. And I'm glad you're able to get together with family and enjoy them. He also sent a message on some of you that are here on that logger have seen. He thinks DMR might be disconnected from QuadNet, so he was coming in through DMR. Is there anyone that's successfully coming in through DMR now? Please let us know. Oh, Kelton says it's back now that he's copying. Maybe one of the administrators noticed the message and took care of it. Maybe it was just transitory. Kelton, since everything's back, why don't you go ahead and take the mic? PY2BBQ, AA4FL.
Okay, 4FL and the group, this is PY2BBQ Hilton from Sao Paulo, Brazil. Yes, I lost you for the last few minutes. And the interesting thing is that when I tried to transmit, I could see my transmission in the Brandmeister host line. and don't know why I was not receiving you from Brandmeister DMR. Probably some issue with the Quadnet, but now it seems to be working fine. So, first of all, nice to be here back this Saturday, and even better with Jay in the comment. Please don't let me run the the round again, okay? Well, the news here in Brazil, we had a sad, uh, the pity.
I sent him a message. I lost him here. I suspect, yeah, I see that Andy had the same message. It was in and then gone. So there's still an issue on the DMR side. Steve, K3SGT, are you coming in through a different mode? Go ahead.
AA4FL and the group. This is K3SGT. I continue to hear Hilton on my DMR. I have my DMR hotspot and Anytone radio on DMR, while my DV Megacast was on the XLX307 reflector. Philadelphia is like other big cities, diminishing, but the
Thank you, Steve. Sorry to hear about that event that happened. You know, there's so much stress out there right now, and there must be so much PSTD going around just from life, survival these days. The overhead of survival is people being on the fringes has got to be a cumulative.
Not linked. Linked XRF757A.
Okay, nothing heard. Are there any check-ins? Any additional check-ins? So go ahead and make your call to net control AA4SL.
Jay, I'm trying to transmit now via D-Star. Can you?
QSL Hilton, you're perfectly readable through D-Star, and I'm coming in D-Star through through a stick. But yeah, go ahead, because you got cut off before in your report. PY2BBQ AA4FL.
JA4FL and the net, this is PY2BBQ Hilton. Transmitting now via D-Star by the Atlanta reflector. And I don't know how much you have copied from my first try. What I was saying that please don't let me run the net again as last Saturday. And good to be here again. Regarding the COVID-19 here in Brazil, yesterday we reached a very sad mark that was 600,000 deaths from COVID-19. It was pretty high, but we are in a moment that the cases are dropping really fast, and including the number of new deaths. And that's because of the vaccination, and that's going very fine. We have here in São Paulo 99% of the population, of the adult population, vaccinated, and used with the first dose.
Well, thank you for coming back and changing modes here, because the D-Star was working beautifully for you, Hilton. I was able to copy everything, and thank you for the comments about the ether. I'm glad you enjoyed it. We were having a discussion before the net started, and it's a little bit of a different format, and the ether is a beloved publication for years in print, and it's not like we've just taken a print publication and put it online. The alternating issues here that are online are truly hypertext driven with a different philosophy, and that philosophy is to introduce subjects and provide links to in-depth information for those who would like to inquire, but not force anyone to read more than they want to, but offer a primer, an introduction in context. So put it in the context of what's important. So it's not just a standalone article about technology, but it might relate to something that's occurred in Markham in the past, or something that's a current event, et cetera, et cetera. Any other comments about the ether? This is AA4FL. Go ahead and make your call. Okay, no other comments. When I used to teach the use of the internet to dentists in the early days, and I would had online courses. They would actually get credit through the Florida Dental Association for taking the courses, but the search engines were so much different back then, and information acquisition was so much different. So I remember one of the ones that was used back then was Dogpile, and it was Dogpile because that's pretty much you would go in and inquire about a subject, and what you would get back is a dog pile of information. So you actually had to train professionals how to use the internet in an effective way to gain knowledge that was useful for them. AA4FL, any comments about that? Go ahead.
WJB.
WJB, go ahead, Andy.
Well, I think that's a really good point. I've been around internet and computers, for a long time, and using it for amateur radio purposes as well as medical record keeping well before most individuals. In fact, I actually helped write a medical records program with the assistance of a programmer back in 2002, and actually put it online about 2002 and used it for 10 years in my practice with me and my 4 other partners. So back in the early days, as you mentioned, when the search engines were multiple different ones, you actually got information just collected. You could get anything. Just lots and lots of stuff. You mentioned the name Dogpile. I don't remember that one, but the ones we were using at the time did that. Whereas nowadays, when you use a search engine, mostly commercially motivated, and you go searching something on Google or even Yahoo or those, you want to look for something that say for a review, and you cannot find anything, or if you do, it takes you a long time to find something that isn't obviously tied to the company that's selling it. So, big difference, and you still have to be trained to look for what you're looking for, and trained to look for stuff that's not biased. So, of course, we have, as physicians, we're always looking for that when we look at medical literature. So, I am coming in on DMR this time. I just want to make sure everybody's doing okay. I am coming through the IPSC2 server instead of Brandmeister, though. Back to you, Jay, from WJAB.
Yes, Andrew. Copying the audio is a little hot there, a little distorted, but was able to copy everything. Thanks for the explanation. I'm trying to think exactly how far back the courses were. Probably around the same time as you, maybe a couple of years ahead. And the University of Florida they weren't using any computerized management software, and they didn't have digital radiography. So the students were very hungry for that, and I was able to teach courses there at the university and let them. Fortunately, had associates. I was able to take 2 at a time into the office and let them shadow me and put them through the paces. And we had already been pretty much paper-free by that time and film-free. So yes, it was a different world back then, and the commercial aspects of it now is, with all the discussion that's going on right now with certain companies, is very obvious. Everything's monetized. Let me let it drop one. The philosophical discussions at the time, and the 2000 era, actually, when I was up in Chicago at the American Dental Association, I was very much a proponent of free speech and letting the little person have their voice. And back then, we had just come off some of the commercial failure is a big business to predict their future. The Time Warner mergers and such with AOL. So it was a different world, and of course we've gone where everything is big business now, as Andrew said. So, and our information is not necessarily our own for good reasons and ulterior reasons and commercial reasons and political reasons and theft reasons. So, no soapbox here. Anyone else who would like to make comments on the subject? I'll make a list. This is AA4FL. Go ahead and put your name to the list.
Just W5SLG Wireless XM for the Cloudnet array. I've seen all your traffic come through on DMR Plus as well as YCS, Wireless X. I know there was, but I'm not seeing traffic from the Brandmeister side. So I have reported it to the XLX admin and administrator, and hopefully they can reset that and get it going again. W5SLG.
W5SLG, thank you very much for reporting that and acknowledging that there was an issue on the Brandmeister side. Thank you. And that was originating on their side, but we do appreciate you being attentive to letting everyone know so they can at least investigate. Thank you very much. We appreciate it. Any other comments about the subject that we were discussing about the internet, and in the context of perhaps of medical information that patients would find? Go ahead and we'll make a list if you'd like to participate in that. Go ahead.
Spot and I just got it back, and I imagine it's because of what was just said. So what are we talking about?
K3FZT.
Okay, this is AA4FL. We're discussing about search engines and finding useful information and information that isn't necessarily tainted by commercial interests. So that's where we are, Mark. I'm going to let Hilton start with his comments. PY2BBQ, go ahead. Yes, Hilton, I agree. Problematic. A little story before we move to Steve and Mark. Back in, oh my gosh, I don't remember what year my daughter had a problem in high school, but I had heard publish a website about being drug free, and we kind of went down the different problems in classifications, alcohol, narcotics, and wrote a little website for it. So one day at my office, we got a phone call from Court TV, and they wanted to interview my daughter. So they happened because we hosted it through the Gator Dental website, and I had to explain to them that she was 13 years old. So, and they wanted to interview her because it was so early in the internet, and that was what they considered to be the most accurate information that we had written. Kind of funny. Let me turn it to Steve, K3SDT.
AA4FL in the group. This is K3FZT. You know, I think it's a little bit of an apples and oranges comparison in that I've read, seen more than a little bit of information that says that a lot of folks, in fact, are not using search engines. They are gleaning the information they glean on Facebook and other social media, YouTube a big one, and that they do their searches within those walled gardens. Furthermore, comparing search engine coverage in the early 2000s with today, when we know there are active disinformation campaigns underway, the Russians, the Chinese, the North Koreans are running active disinformation campaigns because they enjoy and feel they benefit from social, societal discord in the United States, which the disinformation they plant, contributes to. Let's leave it at that. So, that there is no direct compensation for the time a physician spends online searching alongside a patient, only in the event of the various prepaid plans could one presumably ascribe some of that time to that kind of work. So that's enough for now. This is Steve in Philadelphia, K3FZT.
Well, thank you, Steve. Well, we're empowering people, that's for sure. The approach doesn't necessarily have to be the professional, but dental associations, medical associations, regional, I know there's a liability issue, but providing links is a way around that. We did it on the dental level. We used to write pages of reputable sources to link to, but though it's the half-life of information these days, you'd have to constantly be there verifying that the links weren't broken. It used to be a much simpler world. We're using ham radio for the students at W4DFU University. We have a links page. It needs to be updated. Yes, time intensive, very time intensive here. Although it's worth the time from a public health standpoint to offer up good resources. I think we did that a little bit in the ether. So, WA1EXA, Mark, go ahead.
WA1EXA. Well, in pharmacy, we've been dealing with this really in two different ways. There's the pharmacists that are in community practice, and then there's the pharmacists that work in the hospitals. The pharmacists in the hospitals typically don't have that problem because they're dealing directly with the physicians on rounds. And they tend to utilize information from services that they purchase and that they've used for a long time in a printed form, and now they're just in a online form of things like vaccine comparisons and other reference materials that constantly update. As far as the community side, we have the same problem with people coming in and saying, you know, a myriad amount of stuff, and they're getting it off the internet, and probably from more social media than anything else. And it requires the same issues that you guys have faced, I'm sure. But they tend to, the pharmacists tend to use the information that is in their proprietary systems to use to fill the prescriptions. And that's usually connected to some commercial information system, as back to Johns Hopkins or the Mayo Clinic or something like that. Each of those systems that are used for filling prescriptions have contracts with other with other information services. So, but the problem exists, and it's just who are they going to believe? Sometimes, no matter what you say, they still don't believe it. And time is an issue. We only have so much time that we can spend without getting all backed up, and then everybody starts complaining. So that's probably the best way I can answer that on the pharmacy side. Back to you, Jay. WA1EXA.
Question for you, Mark, because it's been in the news so much lately, and obviously it's an issue. Ivermectin for COVID. You want to comment on what you see in the news and what you see online about that, and whether or not that's taking a positive or negative course?
WA1EXA. Well, as far as the ivermectin goes, all of the what we call credible information is saying that it doesn't work, and it should not be used. And same thing you hear. And all of the patients that are coming in that are looking for the magic bullet are still asking for it. It takes some time to convince them that that's not the best thing to do. But we've had this problem before. This is not unusual. We've had a number of times where there's been local infections and local epidemics that have been happening, and somebody finds out something on the internet. So the only thing with this drug is just that this is a national information, but it really comes down to, have you built a rapport with the patient, and if they believe you. Sometimes you can talk yourself through and they turn around and do what they're going to do anyway. And other times they really do change their opinion and avoid some problems. WA1EXA.
Thank you. Andrew, I'm trying to remember if you had made a comment about traditional use in the past of that medication having some clinical value. Was that you last week that brought that up, WJ8B? Go ahead.
Well, it wasn't me last week, because I was in listening mode only and I couldn't hear anybody other than their call signs. I will bring up something about the ivermectin, though, that happened to me via a civilian male spouse who believes that ivermectin and several other non-recommended therapies are being withheld on purpose and et cetera, and had several people call or try to get a hold of me to get me to write a prescription for ivermectin and azithromycin and so forth during the pandemic. And, and of course, I always refuse because of the data, but that's one thing that I could relate to. Back to you, Jay. WJV.
Okay, thank you. My memory's not serving me correctly, but someone had brought up the historical reason. It's just been obviously discussed so extensively on the standpoint of non-supported studies, studies that didn't turn out to have relevance. We talk about commercial reasons, but this reason seemed to be more tied to the anti-vaccine movement. And the studies that were mentioned ended up not being valid. I think some of the studies were Egypt, Iran that I read about. So you're seeing the same things that I'm seeing in the public venue. But just interesting, people are looking and finding what they're wanting, and they want easy answers, and I guess that's human nature. Any other comments? AA4FL.
Out of interest, the same individual refuses to get vaccinated and also thought to go out and get COVID, thinking that they would be 27 times better improved immunity from having it than the vaccine, of course, all of which we know is not true. Back to you, Jay, from WJP.
Well, may the nightmare be over soon. Let's not have an escape mutant come visit us, since Delta seems to be waning and vaccinations are up, and soon there'll be vaccinations for the children as well. And I'm sure we'll have a chronic state, but let's hope it's a diminishing state that's a manageable one. It's hard to fathom how many individuals have died. And you think about it in practical terms. What I found interesting, and you all read the same that I do, and there's a lot of people out there that don't understand exponential growth and how we get to so many people that have died, and they don't realize that early public health measures had value. If we had done what certain other countries had done, the estimated savings of lives could have been 500,000 plus people, less people dying. So, but we live in a society of many opinions, and unfortunately, from a public health standpoint, it takes buy-in of everyone to get the result that some of the other countries did with what we would consider to be more draconian measures, I suppose. Any discussion about that? AA4FL. Take a list. Hilton, I'm going to turn it over to you. So Hilton, an American football stadium, probably about 80,000 100,000 people, maybe 90 in a big one, some smaller. I'm sure the pitch in Brazil for soccer, for football, probably same. It's hard to believe 7 or 8 stadiums full of people would die. Go ahead, Hilton. Us now, PY2BBQ. Oh, thank you, Hilton. And from the soccer or football stadiums, I wasn't meaning that there was a risk factor of exponential growth now. What I was just a vision from being able to visualize how many people, 600,000, 700,000. I mean, that's, 7 or 8 stadiums full of people all dying. Not because they went to a game, but just from a visual. How many, what it actually means to have 600,000 people die. I guess you could say in the population of a city disappearing would be an equivalent. Here in the United States, often you hear it about wars, more than World War I and all the wars to date from them. Of course, the Civil War probably killed more than that, but just visualization. Let me let it drop one. From a philosophical standpoint, and not a political one, be pro-life in one arena and be anti-public health measures in the other. It just to me does not seem logical or normal processing. There's a disconnect in the and the higher level thinking at that point, I suspect, or certainly it's just beliefs that are too hard to overcome. Any comments? AA4F, I'll make a list.
This is 5 RTF. I just want to add that you may be able to beat a disease, but you can't beat Darwin. He always wins in the end.
Okay, thank you for coming back to us, Chip. I'm glad you're still here. As a psychiatrist, what is your take on some of the discussions we've been having over?
Well, in any public debate that's not an existential crisis, I always opt toward freedom. You just have to allow people to have freedom, unless it's immediately going to harm someone else. And what's going on now is that people just don't trust their government anymore. They've been lied to so many times in so many different ways that they just really, why should they believe this? Well, this is different. Well, prove it. And it can't be done. I mean, you can only lie to people so many times until they just plain don't believe anybody. It's a very dangerous situation. By the way, I did find your picture. That's the CAT scan of the kidney, right?
QSL just said my image was in there, but the image is a CAT scan image. QSL, over.
Yeah, that's about all I had to say. Ultimately, people either take whatever path they're allowed to, and I say, let them do it. Let's just see what happens. The historians will write this up, and maybe we'll be around to see some of the early reports on the pandemic of 2021, 2020, and 5 RTF.
Thank you, Chip. The comments about freedom and erring on the side of freedom, I understand, but at one point it's personal freedom, but on the other point you're affecting someone else's freedom to be safe. So it is complicated, isn't it? And this is all in the public venue of discussion. So it's nothing new that we're discussing here, and it's not political or religious in nature. It's just sort of acknowledgement of some of the ironies in life, that what's freedom to one person is not necessarily to the next, because you're violating their freedoms, et cetera, et cetera. And there is not necessarily a right or wrong answer, but from a public health standpoint, public health can predict the outcome to a degree on what will happen, and I think they did. And unfortunately, public health measures suggested were not adopted. So that's something, as Chip says, that will be written about and discussed, and hopefully it'll be another 100 years before there's a pandemic of this seriousness. If there's no other business or comments here, I'll take a list. If there are, we'll call the net to a close. And thank you for everybody joining the Medical Amateur Radio Council DV Net here today. AA4FL Net Control. I'll be back again next Saturday as well, but from the North Florida QTH. Any other comments before we bring the net to a close? Go ahead and call AA4FL.
EXA?
WA1EXA. Go ahead, Mark.
I guess in closing, I think that the issues that a lot of people they look at them in two different ways. I think the issue regarding the vaccines, COVID, is a political issue to them and not a medical issue because it was never presented in the beginning as a medical issue. The abortion side is more of a religious issue, and they don't even see it as a medical issue. And then there's other things like, capital punishment and things like that. But a lot of people see these in silos, and that's why you see the same person that seems to be in favor of one thing, and the same thing called by a different name they're not in favor of. They see them as a different consideration because it's a different issue. But that's what just my opinion. 73 to everybody. WAVA next time.
Thank you, Mark. That actually helps me to visualize it very well, describing it as silos, because silos is something in communications that we often are confronted with, even within organizations, where one part of an organization doesn't communicate well with another to a greater harm for the overall body, even though each section is doing their job and doing it well. 7-3, everyone, and it's good talking to you all our friends here in the Medical Amateur Radio Council. Hopefully some of you that were listening found the conversations useful. Again, it's we're not talking politics or religion here. We're just pointing out some of the background information of the current events and what's happening and the different interpretations that are occurring. Philosophical discussions, guys. 7-3, and hope to catch everyone next week. This is AA4FL bringing the QuadNet net today, and in appreciation of the technology allowing us to have it here to a close. We'll be back again next Saturday at 1500 UTC. AA4FL will be monitoring. If anybody would like to say hello, post that. 7-3 returning QuadNet array to regular amateur traffic.